NBC 739 News this weekend. Coverage you can count on.
Well, federal health advisors are recommending silicone breast implants be put back on the market. The decision made Wednesday comes after 3 days of testimony and only applies to California manufacturer Mentor. The company argued their newer implants are more durable and less likely to leak. But before sales can resume, advisors say the company must meet strict conditions.
After thorough review of the scientific data presented by both the company and the FDA, and after thoughtful consideration of various points of view presented by the public, the panel has voted 7-2 to recommend approval with conditions as outlined this afternoon.
The conditions include limiting distribution to specially trained plastic surgeons, tracking implants through a long-term registry, and requiring an MRI be done after 5 years to check for leaks. There is still a lot to consider for any woman who's thinking about getting breast implants. Margaret Radford is with a guest who can help answer some of those questions that you might have. Maggie?
Thanks so much, Tony. And a lot of women do have questions. I'm with Dr. Scott Bartlebort. He is the chief of plastic surgery at Scripps Memorial Hospital in La Jolla. And doctor, I just want to get right into this because we do only have a limited amount of time. And one of the things I've heard the most as I speak to women, with all the controversy, with all the concern, why would a woman choose silicone over the saline implant, which we know is safe?
Okay. There just is a difference. Both implants are good and both are effective, but there is, I think, an improved result in terms of the overall quality, both visually and palpably, for a silicone implant. I brought one of each with us here today. And Margaret, I'm just going to have you close your eyes a second.
Okay.
And let's see what you think. Which of these feels more natural to you?
Okay. I think this one does.
Okay.
This one does.
Yes, and that is what most people, most of my patients will state. And this is the silicone implant.
So the silicone feels more like a natural breast, and that's why women prefer it?
Correct. Both implants are good, and both of them can give an excellent result for patients. But there's no question in my mind that from an aesthetic perspective, that the silicone implants more accurately mimics the feel of a natural breast tissue.
Now, has there ever been any scientific evidence that these silicone implants are a health risk?
Okay. 13 years ago, when the silicone implants were removed from the market for general use, it was because of a fear that they might possibly cause some type of systemic disease, particularly rheumatoid arthritis, systemic lupus disease. Good follow-up data over the last 13 years has proven that there is no correlation between those implants and those disease processes.
Still, the FDA was concerned enough, this panel was concerned enough, that this is extremely restricted. Why? What are the restrictions and what are the risks?
The FDA's concern at this point continues to be accurate information and informed consent for the patient regarding long-term rupture risk problems. Mentor submitted its data, and it had a 10-year follow-up study that the FDA felt more comfortable with. And at this point, again, it is the advisory panel's recommendation to approve these. It still has to go through the whole FDA for approval.
But the FDA usually follows the recommendations of this committee.
That is correct.
Okay, so real quickly, there are things that women should discuss with their doctors. Could you go over some of the highlights? Okay.
This is real surgery, as this is not simply getting your teeth whitened or something. These are real surgeries with real complications. Make sure you get a reputable surgeon, board-certified plastic surgeon, ideally, to do the procedure for you. There's risk and benefits with it in terms of complications of infection, bleeding, capsular contracture, and possibly rupture of the implant itself. And then the surgeon should go through and individualize what type of technique they're recommending for that patient. For some patient, a saline implant may be the best recommendation. For another, silicone, based upon how much breast tissue the person has to begin with, the thinness of their skin, their size that they would like to be, all these different variables that come into the equation.
This is an important decision, and women need to have this conversation with their doctors, no matter how embarrassed they may be about it or whatever. Doctor, thank you so much for being with us this morning, and hopefully we've answered some questions for women who are considering breast enhancement.